Dr. Vicky Cooper.
Oh, thank you, Chair. Thanks so much for coming along. Really interesting to hear, and the previous panel as well. I wanted to ask you about integration of services in the more broad sense. So I wanted to ask you about integrating mental health services with physical health services, and whether you think that there are examples of good practice in this area, and what more could be done. For example, we heard from the NHS Health Checks team a couple of weeks ago, and Darcy did highlight that there was some good work being done in that area, but I'd be really interested to hear your thoughts on how those two services, which have been pulled apart in a slightly bizarre way, could be better integrated. So I don't know if Lucy, you'd like to start with that. Thank you.
Yes, of course. So one of the great initiatives, which again we heard about earlier, is the physical health check, which everyone with severe mental illness is entitled to annually. There is a target for that, or there was a target that's now no longer in planning guidance for the NHS. So it's no longer a target for the system to increase the number of physical health checks. But this is, so talking first about what the physical health check does and the benefits of it, is that it is that access point for primary care for people with SMI to then be able to get a holistic view of their health, how medication is impacting on them, other lifestyle factors, and then they should then be signposted and transferred to then other support, whether that's smoking cessation services, weight management, diabetic health checks and so on. There tends to then be another kind of drop-off point there where there isn't that follow-up support. But I think the first issue really is that people are not accessing their physical health checks, understandably, and the numbers of people who've been accessing them over the years has really fluctuated. So at one point it was, and I think at the moment it's 60%. In previous years it's gone down to only 20% of people with severe mental illness accessing physical health checks. And I think without that really, really focused, sustained drive from systems to prioritise physical health checks and support people to access them, we're going to see that drop off, again, undoubtedly over the next few years.
Okay, thanks so much. And I just wonder if any of the other panel had any thoughts about how physical health is integrated into mental health services. It does, sort of looking at how the services are, it does look quite separate. And I just wondered if you had any thoughts about sort of bringing the physical health into the mental health space, or vice versa, putting mental health into the physical health space. I don't know if one of you would like to take that.
Yeah, absolutely. I guess I'll pick up on one area where we see these issues particularly pronounced, and that's with people with co-occurring substance use services. Unfortunately, due to the cuts in public health, that's been really undermined, but there are some examples that we can share with the committee where they have integrated that provision and, see the two as issues that kind of exist hand in hand. But if I may, I guess there's also the previous panel talked a lot about social determinants, and there are other services that need to be integrated within mental health and physical health services. So for example, housing support and welfare advice. There's a great example in Hampshire and Isle of Wight where they integrated a citizens advice service within a mental health inpatient setting to provide that sort of comprehensive ongoing support for people. So look at some of those examples and see how we can build on that too.
Perfect.